Welcome back to All Things Home Care with Dana Arnone. It's time for Ask Dana. Our first question comes to us today is, what is physical therapy? Well, physical therapy helps people recover from surgery, an accident, or an injury. Physical therapy helps when the body is changing in a way that is affecting function and quality of life. A physical therapist evaluates a person from the standpoint of their mobility, balance, and strength. What are they having difficulty doing? What do they want to get back to doing? The basic premise of physical therapy is that you're looking at a person's physical dysfunction and determining the steps to take in order to improve the person's physical condition. Our next question is, what happens in a therapy session? Well, there's always that element of a patient's education to help people discover what they're doing on a daily basis that could be contributing to their problem. The physical therapist may need to re-educate a person on lifting something correctly or moving properly. During a PT session, the therapist usually applies hands-on techniques such as joint mobilization for a stiff joint or soft tissue work of stretching or massaging tight muscles. Some physical therapists also do manual manipulation, which uses careful, directed manual force to improve mobility in joints, connective tissues, or skeletal muscles. Physical therapy always involves exercises of some sort, from a low-level stretch all the way to a well-rounded strengthening program. Physical therapy modalities are rehabilitation technologies that relieve pain, reduce swelling, decrease muscle spasms, and improve circulation. These modalities include ultrasound, trigger point pressure, dry needling, soft tissue oscillation, electrical stimulation, traction, biofeedback, heat, and ice. The exercise prescription and hands-on techniques are central to each PT session. Our next question, why do I do these exercises? Some of them make me sore. Well, physical therapists sometimes push people beyond their limit or comfort zone a little bit, encouraging them to go beyond what they think that they can do. Physical therapists try to look at things objectively and implement different tests with patients. We try to empower people to kind of fix themselves. We don't want them to have to keep coming back for more. Ultimately, we're trying to get people to a point where they can maintain themselves and do their exercises at home or at the gym and go on with their lives. Physical therapists push people so that they can be as independent and not reliant on others, medications, or other treatments. So next question, why do physical therapy take longer than I had thought? Well, physical therapy is not a quick fix. Americans in general are notorious for looking for that quick fix. Physical therapy follows the way our anatomy and bodies operate. There's a certain amount of time that is required for certain types of tissues in the body to repair themselves. If you speed up the process, you could experience a re-injury. So physical therapy takes time, patience, and perseverance, and you've got to keep up with the program to experience the gains. Physical therapy recovers in stages, and you have to be present for the whole program from beginning to end if you want the lasting results. Do I really have to go do home exercises? Well, oftentimes people go to therapy only 2 to 3 times a week, depending on their insurance and payment options. The responsibility for improvement falls upon the individual, too. The stretching and strengthening exercises are really something that has to be done almost daily. You're not going to get the progress or improvement you need just relying on going to your physical therapy visits, so you have to do exercises at home. And by the way, we can always tell if someone's not being good about doing his or her exercises program or not. Well, that's all the time we have today. Please email any of your questions to info@allthingshomecare.org.